How do I explain my reproductive symptoms to a doctor? When you need to talk to a doctor about reproductive symptoms, it can feel a bit daunting. But clear communication is key to getting the help you need. Start by being as specific as possible about what you are experiencing. For instance, if you notice unusual lumps or swelling in the testicles, or if you have abnormal vaginal bleeding or pelvic pain, make sure to mention these right away. Next, think about when these symptoms began. Try to recall the date or at least the time frame when you first noticed something was off. This information helps your doctor understand the timeline of your symptoms. Also, pay attention to how often these symptoms occur. Are they constant or do they come and go? Are they related to certain activities like exercise or sexual activity? This can provide important clues for your doctor. Another important aspect is the severity of your symptoms. Describe how intense they are. Are they mild, moderate, or severe? And how do they affect your daily life? For example, do they interfere with your work or personal activities? Don't forget to mention any associated symptoms. This could include fever, fatigue, weight loss, or pain during urination or intercourse. These additional details can help your doctor get a fuller picture of your health. Your medical history is also crucial. Share any previous reproductive health issues, surgeries, or family history of reproductive cancers. If you have been exposed to any environmental factors that might affect your reproductive health, let your doctor know. Using clear and simple language is essential. Avoid downplaying or exaggerating your symptoms. It might be helpful to write down your symptoms and any questions you have before your appointment. This ensures you cover everything important during your visit. If you have specific concerns about testicular cancer, report any lumps, swelling, pain, or heaviness in the testicles. For cervical cancer, mention any abnormal bleeding, unusual vaginal discharge, or pelvic pain. If you are worried about other reproductive cancers, describe any persistent pelvic pain, unexplained weight loss, or changes in urinary or bowel habits. Remember, doctors are trained to ask follow-up questions and perform the necessary exams or tests, like pelvic exams or ultrasounds, to investigate your symptoms further. Being honest and thorough helps your healthcare provider understand your condition better and recommend the best care for you. Lastly, do not hesitate to ask for clarification if you do not understand any medical terms or recommendations during your visit. Effective communication is a two-way process, and it supports early detection and treatment of reproductive health issues.